So now we're going to show you some strengthening exercises for the deep neck flexors. So here I have a pillow underneath Sarah's neck. We're laying down so that she can feel her shoulder blades pushing down into the table. So when we do this, Sarah, we're going to plug your head into the ceiling, keep your shoulder blades pressed down, and we're going to pull your chin back so you're pushing your neck through this pillow. And you're going to count 5 seconds for me.
5, 4, 3, 2, 1.
Good. I want you to stop, relax, and then reset because we're building some muscle memory here. So again, we're going to plug the head into the ceiling, shoulder blades are back and down, and you're going to tuck your chin, push into the pillow, and count 5 seconds.
5, 4, 3, 2, 1.
So you're going to do 10 reps of that for 5-second holds. From here, I'm going to remove this pillow from Sarah's head, and I'm going to have her lift her head, tuck her chin, and she's going to hold for 5 seconds. Go ahead and count 5.
1, 2, 3, 4, 5.
Good, and you can relax. Again, she's remembering that she needs to plug her head into the ceiling and the shoulder blades are back and down. We're going to do that one more time. So she's going to lift the head, tuck the chin, plug her head into the ceiling, shoulder blades are down for a count of 5.
1, 2, 3, 4, 5.
And again, you're going to do 10 reps, 5-second holds. Okay, so for range of motion, as you improve the strength in your neck, you can start doing range of motion. So what I want Sarah to do, she's going to tuck her chin and then bring her neck up against gravity. So you're going to tuck your chin and bring your neck up as far as you can, keeping your shoulders down, and then right back down. And we're going to do that 10 reps.
You guys, these are slow. It's not a fast movement, okay?
Slow and controlled. Focus on pulling the chin back and rolling up, breathing in through your nose and out through your mouth and right back down. And she's going to do 10 reps like that. This is really important to strengthen those deep neck flexors in your neck. So then I'm going to have her lay on her side, face you guys. And we're going to let her relax her head to the side. You can tell that she's at an angle here. So what I want you to do, Sarah, on this is we're going to plug your head into the ceiling, or like an outlet above your head. Keep your shoulder blades back and down. And then we're going to bring this ear towards the shoulder. And just like slow. Make sure your chin is tucked. And then back down slow. So just like we did with the head up, the chin was in, same thing here. We're going to hold for 5 seconds in that position and then let the head down. On this next part, for the active range of motion against gravity, you're going to plug your head in, Sarah. Chin is going to be back, and just bring your ear right up toward your shoulder, slowly. But you're going to make one fluid movement and right back down to the table. Control. Good. So shoulder blades are back and down. Her head is plugged into an outlet above her, and she's bringing her neck up and then down slowly. We're going to do that 10 reps. So now for the neck extensors here, I'm going to have her keep her chin tucked, her head is plugged into an outlet above her, shoulder blades are back and down, and you're going to lift, keeping your chin tucked, and hold right there for 5 counts.
1, 2, 3, 4, 5.
And then back down. And she's going to do that for 10 reps at 5-second holds, remembering to plug her head in and pull the shoulder blades back. We can also do range of motion from here. So I can have Sarah lift her head into extension, so you don't have to keep your chin tucked. Just bring your head up, and then bring your neck back down. Good. And we're going to do that 10 times. Slow and controlled, keeping the shoulder blades back, and elongating the neck so we can decompress it. She would finish this movement by moving towards me, so she's going to lay on her side this way. Do the side bend, and I'm going to show you a rotation here, just because we haven't done that one. So when we rotate the neck, we can also do that against gravity. So she's gonna plug her head into the ceiling, shoulder blades are back and down, and then she can rotate so that her nose is coming towards the top of her shoulder. And she can hold there for 5 counts.
1, 2, 3, 4, 5.
And then rotate back and down. So we would do that 10 reps for 5-second holds. We can also just do range of motion. So she's gonna plug her head into the ceiling, shoulder blades are back and down. She's gonna rotate and look up and over her shoulder, keeping herself elongated and right back down. And we're gonna do that for 10 reps, slow and controlled. And that is how we do strengthening of the neck muscles to help reduce pain from compression injuries.
I want to explain the anatomy to you guys before we do the laying down exercises, because those muscles are really important because they anchor and pull the scapula down towards the floor, so that while you're pulling your head up away from your body and tucking your chin in, your scapula can pull from the bottom, and this is what decompresses the spine. So for fighter pilots, for any of you that have cervical pain, it's really important that you have strong muscles that surround the scapula. So that's what we're going to do here. I'm going to show you some of the muscles anatomically, and then I'm going to show you how to contract these muscles. The first one that I highlight here is the latissimus dorsi. It attaches at the shoulder and at the pelvis. You can see here how big it is. I'm going to light it up and zoom back out. This muscle is really important in shoulder movement. And when I say keep your shoulders back and down, this muscle helps activate the shoulder. It pulls it backwards, keeps it close to the body. Very important. Now I want to highlight the traps, the middle and lower traps specifically, because they will help pull those scapula back and down. And you can see them here. That's that big muscle highlighted. There's the upper, middle, and lower traps. But when we lay on our stomach and exercise, these are the muscles that we're strengthening. Okay, so I have Sarah here, and we're gonna work on the muscles that are in between the shoulder blades that help pull her back into the right position, so that when we say back and down, you're actually able to move the shoulder blades in that direction. Okay, so Sarah, this first one I want you to do is you keep your arms along the side of the body, but I want you to plug your head into the ceiling, shoulder blades are back and down, and I want you to lift your hands about 2 or 3 inches off of the bed. Good, you're gonna hold 5 counts.
1,
Really focused right here.
2,
Keeping those shoulder blades squeezed.
3, 4, 5.
And down slow. And you come back up, again plugging the head into the ceiling, shoulder blades back and down, and squeezing.
1, 2, 3, 4, 5.
You're gonna do 10 reps of that, slow and controlled. Now I want you to bring your arms off the side of the table. We're gonna work on your middle traps. And so, again, this is where the activity is taking place, in between the shoulder blades. So Sarah, plug your head into the ceiling. You're gonna squeeze your shoulder blades together and then lift your elbows up and count 5 seconds.
1, 2, 3, 4, 5.
Let your arms down, but keep the blades together. And then let your blades go. Good. So first we're gonna pull the blades together, then lift the elbows up, count 5 seconds.
1, 2, 3, 4, 5.
Let the elbows down, and then the blades relax. You're gonna do 10 reps, 5-second holds, just like that. On the last one, a little bit more difficult. This is for our lower traps. The lower traps that we looked at on the anatomy that go from here to here. So we're gonna bring your arms up about 120 degrees. And Sarah, remember how we pulled your shoulder blades back? Plug your head into the ceiling. So we're gonna bring this shoulder blade back on both sides and then lift your arms. And you're gonna see that there's not a whole lot of lifting. She's gonna hold there for a few more seconds.
1, 2, 3, 4, 5.
She's gonna let her arms down
and then let her shoulder blades down. It's a hard one. This one's really hard.
Yes.
Especially if you have forward shoulders. And Miss Sarah does work on that herself. So shoulder blades come back. And then bring the arms up. And hold.
1,
You can see her deltoids
2,
coming on.
3,
Trying to help her.
4, 5. Is that weak?
Yeah, she's weak. This is a muscle way down here that's helping hold that shoulder blade back and down. Good. Okay. Okay. So we taught you all these great things about decompressing your neck, getting your shoulders back by stretching the front of the shoulder, and then strengthening the back of the shoulder complex with the exercises on our stomach, strengthening all the muscles around the neck. Now we're going to use all those muscles in the plank position.
Yep. Best exercise there is. Plank hold.
Yes, plank hold. So Sarah, let's show them the plank hold. We're going to have her on her elbows here. So remember we've taught you before, head plugs into the ceiling. She's going to tuck her chin back. She's going to use these neck muscles that she's been working. Her shoulders are over her elbows. Her belly button is pulled in tight. Her hips are tight. Her quads are tight. So here we're in the right position. Shoulders are plugged back and down, and the head is plugged into an outlet above her head. So make sure you focus on those muscle groups that we're working on so that we can decompress the neck and build strength in the back of the spine.
And one of the things I see the most when people are attempting to plank is that they let their head drop.
Yes.
Or they'll hold it here, but they're doing anything just to stabilize themselves. And really, you've got to engage those deep neck flexors and hold it right here, and those scapulars are stabilizers.
And what happens when she brings her neck up to her back? So she brings her neck up, her back dips down. She brings her head down, and her butt comes up. So we want to make sure we plug into the ceiling and really hold and engage those core muscles that we talked about in Well Chapter. Okay, I think that wraps it up for the beginning.
Yeah, guys, thank you. Keep those questions coming. I think that it's really helpful if everybody gets to watch them and see them, and we want them coming from everywhere and anywhere.
And if you have neck problems, these are really good general exercises that will help. But if you have pain, you need to see your doctor
Or
then
your
actually
physical
go in
therapist.
and see your physical therapist.
Yeah.
Let us put our hands on you.
All right. Have a great day, guys.